Would you volunteer to get the coronavirus if it helped in developing a vaccine? It's a highly debated subject among ethicists. Normally in phase 3 of clinical trials, researchers give the vaccine or a placebo to thousands of participants. Then those people go home to test effectiveness in everyday lives, where they may or may not come in contact with the virus. Human challenge trials are different. After getting the vaccine or a placebo, all participants are deliberately exposed to the live virus. Proponents say that would help speed up the testing process, potentially saving lives if a vaccine succeeds. One ethicist we spoke to says we still don't know enough about how much time, if any, challenge trials may save.
Given the risk to participants, it's not clear to me that the social value is there, right? And partly because we haven't answered that empirical question of how much time a challenge trial could save.
Dr. Jennifer Miller says we also need to be careful about who can volunteer. That may mean targeting participants who would already be at high risk of coming in contact with the virus, like someone who lives in a hotspot. Then from that group, choose volunteers at low risk of complications, so younger, relatively healthy adults. Even then, Miller says there's limits to informed consent. Another ethicist argues that given the desperate situation, the possible benefits are much greater than normal. Peter Singer points to the thousands of people who have volunteered on onedaysooner.org, which advocates for challenge trials for COVID-19.
But I think it's a perfectly reasonable choice for people to make, especially young, healthy people who are not at great risk from the virus itself. So even if the vaccine doesn't work, they're likely to be okay.
Testing on animals is also a normal procedure. Human volunteers may replace that step, which Singer says would save time. Challenge trials have been used in the past, more recently with malaria and influenza.